How to treat the flu. Influenza, commonly called the flu, is a viral infection that attacks the respiratory system. Although in most people the illness may last only a week or two, the flu can be very dangerous, especially for children, the elderly, and people with weakened immune systems or chronic medical conditions. Getting a flu vaccine every year is the best way to prevent getting the flu, but if you are sick, you will learn how to treat your symptoms. Method 1: Identifying the flu. Recognize flu symptoms. Before you can effectively treat the flu, make sure that's what you actually have. Flu symptoms are similar to everyday cold symptoms, but they are more severe and occur more rapidly. They may last 2-3 weeks. The following are common symptoms of the flu: cough, often severe, sore throat, fever above 100 F, 38 C, headaches and/or body aches, runny or stuffy nose, chill sensations, fatigue or weakness, shortness of breath, loss of appetite, nausea, vomiting, and/or diarrhea. Distinguish between the flu and a cold. While the flu shows some similar symptoms to the common cold symptoms develop more slowly and follow a predictable pattern of escalation and retreat. Symptoms of the common cold usually last less than a week or two and include mild cough, low-grade or no fever, slight aches or headache, congestion, runny or stuffy nose, itchy or sore throat, sneezing, watery eyes, mild or no fatigue. Distinguish between the flu and stomach flu. What's commonly called stomach flu is actually not influenza at all, but a type of viral gastroenteritis. The flu affects your respiratory system, while stomach flu affects your intestines and is usually a less serious illness. Common symptoms of viral gastroenteritis include watery diarrhea, abdominal cramping and pain, bloating, nausea and/or vomiting, mild or occasional headaches and/or body aches. Low-grade fever. Symptoms of viral gastroenteritis usually only last a day or two but can last as long as 10 days. Know when to seek emergency medical treatment. In extreme cases, the flu can cause severe dehydration or symptoms severe enough to require hospitalization. Seek immediate medical treatment if you or your child is experiencing the following symptoms: shortness of breath or difficulty breathing, chest pain or pressure, severe, persistent vomiting, dizziness or confusion, bluish skin tone or purplish lips, seizures, signs of dehydration, severe headache or neck pain or stiffness. Flu-like symptoms that improve, then return with more severity. Method 2: Treating the flu with natural remedies. Get some rest. Sometimes it's possible to keep working or going to school with a cold, but when you have the flu, it's important to rest. Take a few days off to give your body time to recover. Since the flu is contagious, staying home is as considerate as it is necessary for your recovery. You may experience congestion with the flu. Elevating your head with an extra pillow or sleeping in a recliner can make it easier to breathe at night. Stay hydrated. Having a fever causes dehydration, so it's important to drink more fluids than you normally would to combat the illness. Drink hot fluids like tea or warm water with lemon. These soothe your throat and clear your sinuses while hydrating you. Avoid caffeinated drinks, alcohol, and soda. Choose fluids that will restore your body's nutrients and minerals, not deplete them. Drink hot soup. You may experience nausea and a lack of appetite during the flu illness. Drinking hot soup or broth is a good way to get food into your system without upsetting your stomach. Studies have shown that chicken soup can actually mitigate inflammation in your respiratory tract, so if you're feeling well enough, eating a bowl or two could really help. If you have also been vomiting, you may have an electrolyte imbalance. Use an oral rehydration solution such as Ceralide or a sports drink containing electrolytes to replenish your body. Take a vitamin C supplement. Vitamin C is crucial for supporting your body's immune health. Studies suggest that a megadose of vitamin C can help relieve cold and flu symptoms. Take 1000 mg per hour for the first 6 hours as soon as symptoms appear. Then take 1000 mg 3 times daily. Do not continue to take extremely high doses of vitamin C after you feel better, as vitamin C toxicity is rare but can happen. Orange juice is a good source of natural vitamin C but cannot provide a megadose. Talk to your child's doctor before giving high doses of vitamin C to your child. Clear mucus from your nose often. When you're congested, it's important to clear your breathing passage of mucus often, to prevent getting a sinus or ear infection. Clear mucus in the following ways. Blow your nose. It's simple, but effective. Blow your nose as often as it clogs to keep your breathing passage free. Use a neti pot. Neti pots are a natural method for clearing your nasal passages. Take a hot bath. The steam from the water helps loosen the mucus. A humidifier or vaporizer in your room may make breathing easier. Use nasal saline sprays. You can also make your own nasal saline sprays or drops. Use a heating pad. The application of heat helps relieve the aches and pains that come with flu sickness. Use an electric heating pad or fill up a hot water bottle and lay it on your chest or back, wherever you feel pain. Just be sure not to have it too hot that it burns your skin or to leave it on too long. Never go to sleep with a heating pad or hot water bottle on your body. Relieve fever symptoms with a cool cloth. You can relieve the discomfort of fever symptoms by placing a cool, damp washcloth on your skin wherever you feel feverish. It can also help soothe sinus congestion when applied to the forehead and around the eyes. A reusable gel pad can be found at most drugstores and can also help you feel cooler. To cool a child down with a fever over 102 or a child that is very uncomfortable with a fever, apply cooled damp towels to the forehead to bring down the body temperature. Gargle with salt water. A simple saltwater solution can relieve the sore throat associated with the flu. Mix together 1 tsp of salt with 1 cup of warm water. Gargle for a minute or so. Then spit the water out. Do not swallow the salt water gargle. Try an herbal remedy. There is only limited scientific evidence for most herbal treatments for the flu. However, you may find some relief from one of these remedies. You should consult with your doctor before taking any herbal remedies if you take any medications, have any chronic medical conditions, or are treating a child. Take 300 mg of Echinacea 3x daily. Echinacea may help shorten the duration of your symptoms. Pregnant and breastfeeding women, people taking immunosuppressant drugs, and people who are allergic to ragweed should not use Echinacea. Take 200 mg of American ginseng daily. American ginseng may help make flu symptoms milder. Take 4 tablespoons per day of Sambucol, an elderberry extract. Sambucol has performed well in shortening the duration of the flu. You can also brew an elderberry tea by steeping 3 to 5 grams of dried elderflower in 8 ounces of boiling water for 10-15 minutes. Strain and drink 3 times daily. Try a eucalyptus steam treatment. A eucalyptus steam treatment can help soothe a cough or congestion. Add 5 to 10 drops of eucalyptus oil to 2 cups of boiling water. Allow to boil for 1 minute, then remove from the heat. Move the pot to a stable surface, such as a table or countertop. Cover your head with a clean towel and place your head over the pot. Keep your face at least 12 inches away from the water to avoid burns. Inhale the steam for 10-15 minutes. You can use peppermint or spearmint oil instead of the eucalyptus if you prefer. The active ingredient in mint, menthol, is an excellent decongestant. Do not consume any essential oil internally. Many are toxic when ingested. Method 3: Preventing the flu. Get vaccinated before flu season. In the U.S., The Centers for Disease Control and Prevention monitor global health trends and statistics to develop a vaccine for the strains of flu virus that seem most dangerous that year. Flu vaccines are offered at doctors' offices, health clinics, and even drug stores. They don't guarantee a season free of flu sickness, but they protect against many different strains of the virus and reduce your chances of getting the flu by about 60%. The flu vaccine is available via injection or nasal spray. In the U.S., most cases of flu occur between October and May, peaking in January or February. You may have mild symptoms, such as soreness, headache, or low-grade fever after getting the vaccine. The vaccine does not cause the flu. Choose between the flu shot and the nasal spray vaccine. The flu vaccine is available as an injection and as a nasal spray. Most people can choose either, but you should take into account things such as your age and health conditions when deciding. The flu shot is approved for children 6 months and up, as well as pregnant women and people with most chronic medical conditions. People who are younger than 65 should not get a high-dose flu shot. People younger than 18 or older than 64 should not get the intradermal flu shot, which is injected into the skin instead of into the muscle. Children younger than 6 months cannot get a flu shot. The nasal spray vaccine is approved for people between the ages of 2 and 49. Children younger than 2 and adults over age 50 cannot use the nasal spray vaccine. Children age 2-17 on a long-term aspirin regimen cannot use the nasal spray vaccine. Children 2-4 with asthma should not use the nasal spray vaccine. Pregnant women and people with weakened immune systems should not get the nasal spray vaccine. Caretakers for people whose immune systems are extremely compromised should not get the nasal spray vaccine, or stay away from those persons for 7 days after vaccination. You should not take the nasal spray vaccine if you have taken antiviral drugs for the flu within the past 48 hours. Tips: sleep with a pillow or two under your head to help relieve nasal congestion.